In health news now, infertility affects about 10% of couples of childbearing age. About 25% of those couples have more than one reason for their inability to conceive. While reasons for miscarriages are really a mystery to some women, there are answers and treatments for many others.
45-year-old Maria Belanco calls her daughter a real miracle. For years, Belanco thought she would never have a child.
When my body senses pregnancy, my blood immediately thickens it and make it a lot of antibodies attack my baby.
Belanco had 5 miscarriages before she finally had success. Reproductive endocrinologist Dr. Gelman in Cooper City says Belanco is like many women who suffers from immune problems.
NK cells abnormalities or certain sharing of certain alleles, as we call them, that actually may contribute to a heightened immune system in a woman.
I have 5 miscarriages, and I was going to a regular OB, and they told me it's normal, but I find out it was not normal to have 5 miscarriages.
Marcela Tahor and her husband Igal had no idea they had immunological incompatibility until they took several tests. The good news is there are treatments to help.
The therapies for immunologic losses can include things like heparin and aspirin, or blood thinners for clotting problems or phospholipid problems. But also sometimes used is something called IVIG, or gamma globulin infusions, which seem to block a woman's immune system from actually attacking the pregnancy once it's been established.
Marcela underwent IVIG, and now she and her husband have a happy, healthy son and want other infertile couples to know there is hope out there.
In immunologic therapies, where immunologic therapies are required actually, up to 80% of the time they can successfully be helped.
For miscarriages include impaired egg quality, uterine abnormalities, low progesterone levels, as well as chromosomal anomalies. So there are lots of reasons for these.